I'm Colleen Deeb. I'm a nurse practitioner at Oceanview Med Spa in Frisco, Texas. What we are going to be looking at right now is a video of a patient that came in for a consult. What she was concerned about was some of her fine lines and wrinkles on her forehead and also alongside of her eyes. What we first talked about was her types of wrinkles that she had on her forehead and about how deep they were. She wanted her forehead to still move a little bit. She wanted her wrinkles gone along the sides of her eyes and in her glabella area, which is this area right here. She didn't want this area to move very much. So we appropriately dosed those areas, and we talked about how much medication she needed and about how much money that would be. She decided on Dysport. Now Dysport and Botox will temporarily prevent the muscles from moving too much, depending upon how much medication you put in. Our patient was very excited knowing that that was going to happen in the next couple days. That is, that her wrinkles would be reduced, if not eliminated, in the next couple days. So as you can see on this video, our patient's relaxed on the exam table, and we're starting to inject on the glabella area, which is the area right between the eyes. There is no numbing cream that's required or needed. You may notice that she has numbing cream around her mouth area because that's for a different procedure. There's very little discomfort because the needles are so small and high-tech. We proceed to do the forehead. Again, our patient's still relaxed, feeling very little discomfort. In some cases, you may see a tiny little bulge when we put in that small amount of medication, but the body absorbs that very quickly, just within 60 seconds or so, and that dissipates. Each injection has been properly dosed for that particular muscle area. Her forehead will still be able to contract a little bit, but yet she will not have any lines. And then we go and move over to, on the side of the eyes where the crow's feet are, we go ahead and inject those areas. When she smiles, she'll have just a teeny tiny bit of creases, but nothing permanent. Dysport usually takes a couple days for the wrinkles to start disappearing and for really that medication to start working. And Botox typically takes a little bit longer, usually about 5 to 7 days before you become more wrinkle-free. So once the patient is completed with her procedure, then I apply a thin layer of sunscreen protection, and then I give her her instructions for her procedure so that she'll know what to do when she goes home. The main thing that we ask patients to do is not to lie down for about 4 to 6 hours, and also not to rub their eye area so that it can properly settle and not distribute the medicine in the wrong places. She is able to be wrinkle-free in a couple days.